to 2024. My name is Raymond Kwong. I am an advocate with Disability Rights California. With me today is Leilani Pfeiffer. She and I will be supporting our presenter, one of our senior attorneys, Maria Ariate. So just real quick, an overview of our agency. Disability Rights California, we are a statewide nonprofit agency, and we provide free legal services to people with disabilities with disability-related issues. We have offices statewide, with our headquarters being in Sacramento, with an office in Oakland, Fresno, Ontario, Los Angeles, and San Diego, just to name a few. We have attorneys and advocates who can handle a variety of issues, from access and discrimination issue with housing, with transportation, with education, which includes special education and higher education. We can also help with public health benefits, such as Medi-Cal, in-home supportive services, or Social Security overpayment issues. Within our agency, we also have our Office of Client Rights Advocacy, or OCRA, that specialize in handling issues with the Regional Center, and our Client Assistance Program, or CAP. They handle issues with the Department of Rehabilitation. So everything you see today, the PowerPoint and the links that will be shown in the chat and on screen will be sent to you after the presentation along with the recording. So without further ado, Maria, please take it away and I'll put the PowerPoints on screen.
Thank you, Raymond. Thank you, Flavia, for inviting us to discuss Medi-Cal waivers. I think this training is probably the sometimes the most difficult for people to understand because they have a certain idea of what a waiver is. So I think it's going to be really important to kind of step back and give you some background so that you understand what is a waiver. And I know that some of you have also understand the waiver to be an institutional deed. Well, I'm going to talk about that too with some of these waivers. And hopefully at the end of this training, you'll have a better idea of what waivers are and why we have waivers in California. So you see that this first page of the presentation says Medi-Cal waivers, because waivers are extra services to subpopulations of people in California. Waivers are Medi-Cal services. That's what you need to first understand. They're extra Medi-Cal services for certain people who qualify for the particular waiver. So we're going to talk about what are these Medi-Cal waivers. And there are different waivers based on different sections of the Social Security Act. But our focus tonight is on what are called home and community-based services waivers. One of the home and community-based services waivers that you may be somewhat familiar with is the DD waiver through the Regional Center. But there are other home and community-based services waivers that we're going to talk about. Next slide. So let's step back so we can understand what this waiver means. When California decided that it was going to participate in the Medicaid program, states don't have to participate in the Medicaid program, but it sure is nice to participate in the Medicaid program because you get federal money to help you pay for health insurance for people who need it. What California did, and every state has to do this if it wants to participate in the Medicaid program, is it prepares a state plan. And that state plan is a document that describes the nature of California's Medicaid program. And by the way, in California, it's called Medi-Cal. States can decide they want to call their Medicaid program something else other than Medicaid. Medi-Cal is in California. It talks about assurances that the state is going to give. It talks about the different Medicaid, Medi-Cal programs, eligibility. It also talks about how it will follow federal statutes and regulations and other requirements. If you ever want to look at California's state plan, you can go to the link below and look at it. You might find it interesting. Next slide. So the Centers for Medicaid and Medicare and Medicaid is the federal agency that oversees the Medicare program and the Medicaid program throughout the nation. And so that agency will approve or not the state plan. And of course, the state plan for California was approved years ago. Whenever a state wants to change something in its plan, state plan, it could do it in one of two ways. It could submit an amendment of the state plan to the federal government, or it could seek to waive some of those federal requirements. So when we're talking about waivers, we're talking about California saying to the federal government, we want to waive certain of your requirements. And the federal government, and so they submit what are called waivers. What's a waiver? It's a document over 300 pages. And we're going to look at the DD waiver so that you can get an idea. And the federal government has to approve this waiver for California to be allowed to do something different than what federal law would normally require. So you can either amend your Medicaid program by submitting an amendment to the state plan or seeking to waive certain federal requirements. Next slide. So in California, we have different kinds of waivers based on the Social Security Act that allows for waivers to happen. So Section 1915C of the Social Security Act are the home and community-based waiver programs, the ones we're focused on today. There are other waivers in California, Section 1115 research and demonstration waivers. There's another waiver program, Section 1915B. Now, you see the link below, it says DHCS, that stands for Department of Healthcare Services. You're going to find all of these different waivers in the Department of Healthcare Services website. Why? Because all of Medi-Cal services, right? So you're gonna find it there. And when we go to the DD waiver, you're gonna see that. You're gonna see it play out. So now we're gonna focus on the home and community-based services waiver. What are these? What's the goal of these waivers? And in California, how many do we have? What are they called? Who's eligible for them? So a very important goal of these home and community-based services. It says it in the title of the waiver, home and community-based services. It's to keep people out of institutional care. These waivers want to provide services in the community so that people can remain in the community. That's a very important goal of all of these waivers under HCBS. Now, remember, I said to you, there are two ways to change the program in the state. You can amend the state plan, or you can ask for a waiver. You can ask to waive certain federal requirements. So these waivers, HCBS waivers, is asking the federal government to waive comparability. So the federal government requires that if you're going to have a Medicaid program in your state, that you provide the same kinds of services to everyone, right? Comparable to everyone. And also that you provide the program statewide, so statewide-ness. So if you're going to have a Medicaid program in your state, you can't just say, oh, the Medicaid program is only going to be for Los Angeles, all of the Southern California counties. can't do that. It has to be made available to the state and comparable services to everyone. Sometimes not in these waivers, but income and resources are waived. But what we have in these waivers is something called institutional deeming, and I'm going to talk about that. So when California submits these HCBS waivers, it's asking the federal government, waive comparability, waive statewide-ness. Why? Because they want to provide extra services to subpopulations of people, not to everyone who has Medi-Cal. So in order for you to get these extra services, you've got to meet the criteria for the particular HCBS waiver. So for example, for the DD waiver, you have to be a regional center client. You have to be getting a service. You have to show that if you were not living at home, you would meet the criteria to enter an intermediate care facility for the developmentally disabled at certain levels of care as expressed in the waiver, in the DD waiver. So, that's an important thing to know. So let's go on to the next page. These waivers enable states to provide extra services to target groups. So for example, if you want to be on the DD waiver, you have to be a regional center client, you have to be getting a service, you've got to meet the criteria. If I'm not a regional center client, I cannot apply for the DD waiver because it's not for me. There are waivers for people who are elderly. So for 65 and older, that's the Multi-Senior Services Program waiver. It's a home and community-based service. Not 65 yet, so I can't even apply for it. Plus, I would have to qualify for Medi-Cal because these waivers are extra Medi-Cal services for subpopulations of people. There's a waiver for persons who have HIV/AIDS. Can't apply for it unless I meet the criteria under the waiver, and for all of these home and community-based services waivers, there will always be a requirement in the waiver that in order to qualify for the waiver, you have to show that if you were not living at home, you would qualify to enter a facility at the level of care that the waiver allows, right? It doesn't mean that you have to go live there. It just means that if you were not living at home, you meet the criteria for entering a facility at a particular level of care that the waiver requires. Now, the federal government also allows the states to limit the amount of people who could be on the waiver. So the DD waiver has tens of thousands of slots. There's never a waiting list for anyone to get on the DD waiver. Other waivers may have waiting lists because there are only certain number of slots per year that open up. And the states can do that. States don't have to have waivers. They don't have to have these programs. But California has decided that it wants to have these waiver programs in its state. Next slide. So all these home and community-based services waivers have to show that providing services through the waiver is not going to cost more than it would cost to provide the services in an institution. So that's called cost neutrality. It has to ensure that protection of the person's health and welfare, that there are adequate and reasonable provider standards to meet the needs of the population, and that these waivers are person-centered. There's a person-centered plan of care. Next slide. So let's talk about the Section 1915C home and community-based services waivers in the state of California currently. So we have the Medi-Cal Waiver Program. It used to be called the AIDS Waiver. It's for people for HIV/AIDS, and each waiver has its criteria. So there's more to applying for this waiver for eligibility than what I just said about the waiver. And it's available statewide. There's your assisted living waiver for people who are disabled 21 and over, and it's only available in 15 counties, right? It's not statewide. It doesn't have to be statewide because the federal government waived that requirement. And then there's the home and community-based alternatives waiver. It's for persons who are disabled all ages statewide. There are regional center consumers who are on this waiver and not the DD waiver. And then we have the home and community-based waiver for the developmentally disabled. That's the DD waiver for people who are regional center clients, all ages. It's available statewide. And then there's the multi-purpose senior services program. It's waiver available for people who are 65 and older, only available in 41 counties. And believe it or not, the self-determination program is also a home and community-based service waiver available to regional center clients statewide. So these are the waivers in California currently. So let's talk about the DD waiver. Like I said, it's the waiver with the most slots, no wait list. It's administered by the Department of Developmental Services through regional centers. So if you're a regional center client, you would be applying for the DD waiver through the regional center. You would be having that conversation with your service coordinator. Now, it's very important to know that you don't have to be on the waiver in order to receive regional center services. What does the waiver do for the regional center? Now, you have to step back and say, well, the regional center gets a pot of money, right? It gets a pot of money to pay for services for its consumers. What the waiver does, because the waiver is a Medi-Cal service, there are services in the waiver. For example, the DD waiver respite, for example, is in the waiver. And if the person is on the DD waiver, then those respite services are not paid out of the regional center's budget. It's paid, Medi-Cal pays for the respite. So it behooves the regional center to try to get as many people on the waiver because it helps the regional center pay for services that the waiver would pay for, right? And then therefore the regional center doesn't have to pay for that service because it's being paid for by Medi-Cal. And shortly, we're going to go to the DD waiver. When we stop talking about the DD waiver, we'll go to the DD waiver so I can show you what any of these waivers look like. Next slide. So in order to qualify for the DD waiver, you have to be an active regional center consumer, meaning that you have to have at least a service. Believe it or not, there are regional center consumers that are not getting any services from their regional center. Of course, you have to have Medi-Cal, right? Because it's a Medi-Cal service. Waivers are Medi-Cal services. You have to qualify for care in an intermediate care facility as per the waiver. Doesn't mean you have to enter. It means that if you were not living at home, you would qualify to enter an ICFDD at the level of care that the waiver requires. Now, for all of these home and community-based services waivers, you cannot be enrolled in more than one. So if I'm a regional center consumer, I have to decide, do I want to be on the DD waiver? Do I want to be on the alternatives waiver? If I'm old enough, do I want to be on the MSSP waiver? I can only be on one at a time. Do I want to be on the DD waiver or the self-determination waiver? You can't be on both. Obviously, to get on the waiver, you have to also want to receive services in the community, right? And not be in an institution. Next slide. The main purpose of the DD waiver and all of these home and community-based services waivers is to keep you out of an institution. Now, I want to talk about institutional deeming because some of the waivers that California have, the alternatives waiver, the MSSP waiver, the DD waiver, for example, have language in the waiver that says if this person is eligible for the waiver, the DD waiver, then Medi-Cal, when you're evaluating eligibility for this person, you have to pretend that the person, for example, a minor, a child, is living in an institution, because there's no deeming when the person is living in an institution. Step back. What is deeming? So the general rules for Medi-Cal is that if you're a minor, for example, and you want to apply for Medi-Cal, the resources and income of the parent with whom you live, or parents with whom you live, the child lives, are counted as if they were the child's income and resources. And that can disqualify a child from being eligible for Medi-Cal. Not to, and the child may have his or her own resources and his or her own income, right? So that's deeming. So when you're on the waiver, Medi-Cal will pretend that the child is not living with a parent, is living in an institution, and therefore there's no deeming. So there are children who were not able to become eligible for Medi-Cal because of deeming, who then get on the waiver and become eligible for Medi-Cal because there's no longer deeming of parent income and resources. And deeming ends at the age of 18. So at the age of 18, there's no more deeming of parent income and resources. Institutional deeming also applies to spouses. If I'm a spouse, and I applied for Medi-Cal, my spouse's income and resources will count as if they were mine, and it could disqualify me from getting Medi-Cal. But if I apply for a waiver that has the institutional deeming concept, and I qualify for the waiver, for example, the DD waiver, then my husband's income and resources will not be counted for my Medi-Cal eligibility. Again, the process is you start with your service coordinator, and there's an application process that you have to go through. Next slide. Yeah, so for waiver services, regional centers have purchase of service guidelines to limit services, but if it's a waiver service, the regional center can't limit the service. Also, under the DD waiver, there's an extra vehicle exemption, but if you're on yeah, so just know that, but think about it before you go out and get an extra car, because it may affect another public benefit you might be on. If a child no longer qualifies for a waiver, which can happen, just because you qualify for the waiver initially doesn't mean you'll qualify, because every year you're assessed to see if you continue to qualify for the DD waiver, for example. But if a child no longer qualifies for a DD waiver, Medi-Cal has to reevaluate the child to see if the child qualifies for any other Medi-Cal program before terminating eligibility. And there are provisions called continuing eligibility for children that allow the child, even though the child may not be eligible for Medi-Cal anymore, will allow the child to get Medi-Cal for a certain period of time, despite the fact that the child may not be eligible. So that's called continuing eligibility for children. Next slide. The kinds of services that are available through the waiver. This is just a short list. There's a publication that we have. Chapter 11 is all about the DD waiver, so you can go there. And I want to give you a really concrete example of what it means to be on the waiver and what it means not to be on the waiver with Medi-Cal. So, for example, if I'm at home and I have Medi-Cal and I'm not on the waiver, and I'm getting to the point where my health requires that I have a nurse at home to take care of me, because otherwise I may need to go into a nursing home, because Medi-Cal will pay for a nursing home. Can I get a nurse to come to the home through Medi-Cal? I can't. I'll have to try to do the best I can for as long as I can. And at some point, I may have no choice but to go in an institution. Now, let me give you the scenario where I have Medi-Cal and I'm on a waiver. If I'm on a waiver, like the DD waiver or the alternatives waiver that provides for nursing care at home, I can have that nurse come to my home. You see the difference? Extra services for subpopulations of people. That's what waivers are. Next slide. Now, with any health insurance, right, with anything, there's always a medical necessity, right? You can't just request things without establishing that you need them. They're medically necessary. So under the DD waiver, the medical necessity standard are things that are reasonable and necessary for the treatment of the disability or the developmental condition. The service has to be specific, effective, and skilled. And this goes with any health insurance. Even private insurance has its own medical necessity standard. Next slide. Like I said before, eligibility is reviewed annually through the regional center, and there are people in the regional center who are specialized in the DD waiver, self-determination waiver. They're called qualified intellectual disabilities professionals. And that's what they do. Help people get on the waiver and recertify. Next slide. Okay, so we're gonna go to the DD waiver. There was that link in the presentation, and so Lonnie's going to take us to that waiver. Remember, I said to you that these waivers are documents that are submitted to the Centers for Medicare and Medicaid for approval. So we're going directly to DDS, but if you were to go to Department of Healthcare Services waivers, you would find the DD waiver and you click there and it would take you to the DD waiver. So why are we in the Department of Developmental Services? Because DDS administers the DD waiver and it administers the self-determination waiver too. So if we scroll down to pending waiver, you see here, it says approved HCBS, home and community-based services waiver. So what comes with the waiver is a letter from CMS that's, for example, we're approving your request to amend the waiver because waivers have to be renewed every 5 years, typically. And this amendment, the state is adding new services. So if we scroll down a little further, coordinated family supports, and you'll find information on coordinated family supports in this waiver document, and you'll find it in on the DDS website too, and probably your regional center website. The waiver continues to be cost neutral, meaning that it's not going to cost more to provide the services through the waiver than it would if you were an institution. Is to serve no more individuals than the total number. And like I said, there are slots and there are many. There's no wait list for this waiver. So typically the waiver has a letter, and then comes the waiver, the actual document. And that actual document is this one. You see 1915C of the Social Security Act, Home and Community-Based Services Waiver. This is, if we scroll down, the title of this waiver right here, HCBS Waiver for Californians with Developmental Disabilities. This is the DD waiver. It was effective December 1st of 2023. So the end of the year, last year. And if we scroll down a little bit more, we have different appendices, and you see Appendix A is it talks about waiver administration. Appendix B is about participant access and eligibility. So if you want to see, remember I said that to be eligible for the DD waiver, you have to show that you would be eligible, that you would, if you were not living at home, you would be eligible to enter an ICF-DD at the levels of care specified in the waiver. Well, that's where you would go, is that appendix, oh, don't move it. Appendix B actually tells you the criteria for eligibility for the waiver. Appendix C, participant services. So people ask me, well, what kinds of services can you get through the waiver? Well, I say, look at the RULA, but more importantly, Appendix C tells you all of the services that are available through the waiver. And we're going to go to page, in a moment, we're going to go to page 66, which summarizes the services. And then there are pages and pages and pages under Appendix C, describes the service, describes who could provide the service through the waiver. And there are other appendices, right, that are also important. So if we scroll down to the next page, then it says here, the waiver is a 5-year waiver under C, 5 years, the effective date, and then we scroll to the next page. The next page tells you what's the level of care that's required to be eligible for this waiver. So we scroll down, down, down to the next page, and it checks off, right there. It checks off intermediate care facility for individuals with DD, as defined by 42 Code of Federal Regulations, section 4401.150. So there are different levels of care that this waiver will consider. And you can go to Appendix B, or you could go to the Code of Federal Regulations, to this citation, and look up the information. It's not concurrent with other programs. You cannot be on more than one waiver at a time. And then we scroll down. And then it gives you a brief description of the waiver, and then if you scroll down a little more, that the regional centers are responsible for administering, for outreach, intake, assessment, evaluation, diagnostic services, case management, et cetera, et cetera. And that DDS is the oversight agency for the waiver. Next page. And then the different components of the waiver. Again, section C is the participant services. So and you see on the right-hand side up above, it says page 6 of 395. The waiver is 395 pages long, right? This document. So if we go to page 66, that's where Appendix C starts. That's where the services are described. So if you want to know what services the waiver has, that's where you go, to Appendix C, and who can provide the service. And by the way, all of these home and community-based services waivers, they all look like this. It's the same format. Appendix C will always have the services available through the particular waiver. Appendix B will have eligibility. And so Appendix B, let's scroll down. So here's, can you just go to the prior page? Because I think that Appendix C starts right here at the bottom. See Appendix C, participant services. And so there's a table here that gives you an outline of the services that you're going to read about. So if we go to the next page, all of these services here are waiver services. So remember I said respite care. So if you are eligible for respite care and you're on the DD waiver, guess what? Medi-Cal is paying for it, not the regional center. Otherwise, if you were not on the waiver, the regional center would have to pay for it out of its own budget. So these are the waivers, and they all look alike. Different language, right? Because different types of waivers, but the format is all the same. So if I go to this, I'm gonna take you, thank you, Lonnie. I'm going to take you to the self-determination waiver. And you're going to see this is the self-determination waiver. Self-determination waiver. And you see it's all the same format. It's a 5-year waiver. This waiver is effective July 1st of 2021. And it tells you what level of care you have to qualify for to be on this waiver. And a brief description of the waiver. It looks familiar, doesn't it? And participant services are in Appendix C. Eligibility is on Appendix A. Waiver B, I'm sorry, and waiver administration in Appendix A. All of these home and community-based services waiver have the same format. Now we're going to go back to the PowerPoint. Okay, self-determination. Okay, so we're going to continue. Go to the next slide, please. Oh, wait. Go prior to self-determination. There's a prior slide. Yeah, so the next home and community-based services waiver is the self-determination waiver, a program that provides individuals with self-directed, more freedom to direct their care. And there's a whole process you have to go through. You develop a budget, you develop a spending plan, you have fiscal intermediary involved with paying, you can have an independent facilitator help you, and all of that information on that waiver is in the links that I provide here. So, and how do you get on the self-determination waiver? You talk to your service coordinator, and then they should explain it. There's also an organization called Disability Voices United. They have a lot of good information on the self-determination program. I believe they have ongoing meetings over the phone or Zoom or whatever to talk about self-determination and the issues that people have had with the self-determination waiver. So yeah, it's a relatively new waiver, so of course there are going to be kinks, but there's a lot of information out there. The next waiver, a home and community-based services waiver, is the home and community-based alternatives waiver. Currently, there's a wait list. And when a slot opens up, there's priority given to people who have been in a facility for more than 60 days at the time of application, that the application was submitted. And also people who are transitioning from one home and community-based service waiver to another, because their needs can't be met under their current waiver, and applicants' children under the age of 21. So when a slot opens up, there is priority enrollment for these people. Next slide. So the types of services that you can get, these are just examples of the kinds of services you could get through this waiver: personal emergency response system, private duty nursing, medical equipment operating expense, facility respite, et cetera, et cetera. And where do you find information about the services that are provided under this waiver? Appendix C of the waiver, right? You go to the waiver and you go to Appendix C. Next slide. More services: respite, habilitation, case management, waiver personal care services. And there's more information about all of this on this link. Waiver personal care services is something that I don't think is available through the DD waiver, where, you know, this waiver requires that if you were not living in a facility, you would be eligible to enter a nursing facility level A, level B, an ICFDD continuous nursing level, which is the highest level nursing in the ICFDD, subacute care or acute care. So those are the different levels of care that allow you to get on this alternatives waiver. And the care is given typically by an LVN. Sometimes, depending on the kind of care that's necessary, it has to be an RN, registered nurse. But under waiver personal care services, if you meet the criteria and the doctor agrees, you can, rather than having an LVN provide the service, it could be someone else who's not licensed as an LVN, and that you get a budget, right, of money. And so that allows you to stretch your budget, right? So because you're paying the LVN at a certain rate. If it's not an LVN and someone that doesn't have that level of expertise, then you're paying them less, right, per hour. Anyway, interesting. That's why sometimes people are not on the DD waiver. They prefer to be on the waiver personal care services waiver. Next slide. So what you do to apply is you call this link that you see here will take you to the waiver agencies in the different counties. However, if you're in any of these counties listed here, Alpine, Imperial, Napa, Mono, Mendocino, Marin County, you call Department of Healthcare Services in-home operations. That's the entity you would call to apply for this waiver. Otherwise, you call the waiver agency in your county, and all of that information is in this link. Next slide. The assisted living waiver is another home and community-based services waiver. It provides assisted living, including personal care, coordination, and you agree to live in a residential care facility for the elderly or subsidized housing. You have to be 21 or over and have Medi-Cal without a share of cost. And meet the nursing facility level of care that's required in this assisted living waiver, right? If you were not living at home, you would meet the level of care as per the assisted living waiver. And the waiver is available in these counties that you see here. It's not statewide, right? Because it doesn't have to be. The federal government said it doesn't have to be. So this is where the assisted living waiver is available. There might be a wait list in your county. Who knows? Next slide. Services includes personal care services, companion, medication oversight, social and recreational programming in a home-like environment. There's going to be someone on site 24 hours to make sure things are going smoothly. More information on that waiver is on the Department of Healthcare Services website. And guess what? Where do you go when you want to see all of the services that are available through the assisted living waiver? You're going to go to the assisted living waiver and you're going to go to Appendix C, right? Next slide. How do you apply? You call in the county, if you're in one of those counties, you call the Care Coordination Agency. And there's information here on the assisted living waiver and the care coordination agencies. I worked on a case where the son came to me and he said, my mom, she's starting to show signs of dementia and I'm concerned that she's living alone. And so I said, well, there's the assisted living waivers available here in San Diego. And I said, well, I think this waiver is for her because she still gets to live somewhat independently, but she has someone to provide assisted living care, right? And so I contacted the coordinated care agency here in San Diego, and they were extremely helpful and helped her get on this waiver. Became a little creative, but in getting her eligible for the waiver. And so she was able to get on the waiver and get services that she needed because of her cognitive decline. So this is another waiver. And then we have the multi-purpose senior services waiver. It's for people who are 65 or older. Again, this waiver, the MSSP waiver, if you look at it, will say if you were not living in at home, would you qualify? Would you meet the criteria for entering a facility at these levels of care, right? And then you have to reside in a county that offers this waiver service, and the counties are all here. You can look them up. They're in about 40 some odd counties, so a lot of counties have this program. There may be a wait list though. Who knows, right? Depending on the county. Next list, kinds of services, care management, adult daycare. I've known this program to provide diapers, meal services, transportation services, respite, communication services. Where do you go to find what services are available under this waiver? You go open up this waiver and you go to Appendix C. and it'll tell you all of the services that are available through this waiver. Next slide. How do you apply? You go here, Department of Aging, and you find your county, and then it'll give you instructions on how to apply. Next slide. And finally, the Medi-Cal Waiver Program, formerly known as the AIDS Waiver. It provides case management, direct care services to people with HIV/AIDS. And again, if they were not living in their home, would they qualify to enter a nursing facility level of care as per what the waiver says, the Medi-Cal Waiver Program? To find a provider, you go to that link, and how to apply, you go to the Office of AIDS. Next slide. So we've come to the end of the presentation on waivers, and we can take questions.